Hello everyone, I'm Zeal and my group members are Archie, Krishna, and Yash, and we will be talking about hearing loss, specifically focusing on dental care. Our goal is to highlight the challenges individuals with hearing impairments face and discuss ways to ensure better communication, inclusive treatment, and a more positive clinical experience for them. Hearing loss is not what you think. So when we think about hearing loss, there are a lot of misconceptions. Some people believe that only older adults experience hearing loss. Speaking louder will solve the communication difficulties. Hearing aids completely restore hearing. People with hearing loss can read lips perfectly, and that people with hearing loss are less intelligent. In reality, hearing loss affects individuals of all ages, and each person experiences it differently. Simply speaking louder does not address the communication barriers, and hearing aids do not fully recover hearing. Not everyone with hearing loss can read lips accurately, and many rely on other forms of communication. The belief that individuals with hearing loss are less intelligent is simply untrue and overlooks their abilities and potential. To improve how we communicate and provide care, it is crucial to address these misconceptions and ensure that individuals with hearing impairments receive proper care.
We, as a dental professional workers, it is really necessary for us to understand the unique needs of these individuals with hearing impairment to ensure clear communication, inclusive treatment, and a satisfying clinical experience. It is our duty to make sure that these patients receive the highest standard of possible treatment, personalizing our treatment plans and communication strategies to fulfill their requirements. Our presentation will focus on the difficulties faced on these individuals with hearing loss in their day-to-day lives, the obstacles they face while receiving the dental care, and the ways in which dental hygienists can overcome these difficulties to offer the right treatment for them. People have different degrees of hearing loss in which they represent a unique group of individuals who often face additional challenges in both general life and dental care. Due to the hearing loss and dependency on hearing aids, they face different challenges. Depending on the type and severity of deafness, their experience might differ, and due to which it can affect their general well-being as well, and communication and access to care. There are various degrees of hearing loss where we must pay attention while administering dental care. Here is the major category of degree of hearing loss, which most of the people are categorized in, which is moderate to mild hearing loss and severe to profound. In moderate to mild hearing loss, people experience difficulty in hearing quiet spoken words, soft spoken people, and may have hard time to keep up with the conversation when there is noise in the background. So these people mostly rely on lip reading or hearing aids, and since hearing aids cannot entirely restore auditory precision, individuals with severe to profound hearing impairment use more visual strategies such as sign language, written communication, or lip reading. In this picture, we can see as the graph is presenting the level of hearing loss from normal to profound. Here, it shows that if a person has a normal hearing ability, they would be able to hear whispering sounds like water droplets, clock ticking, etc. While going further down towards people with moderate hearing loss, they cannot hear normal voice conversations unless the person is directly facing, and they could lip read or use any hearing aid. Comparing these to more severe to profound hearing loss, people can hear extremely loud noise like airplane or truck engine, but not everyday sounds. They would mostly rely on sign languages, cochlear implants, or other methods.
So now we are going to watch a video of an individual suffering from hearing loss from age of 6.
I was born 4 weeks earlier or so, and I passed my newborn hearing screening. Everything was fine, but at the age of 6 is when my family started noticing like I was behind in my speech and I wasn't responding to them as often. So they went and got my hearing tested, and they found out that I have enlarged vestibular aqueducts and mild cochlear dysplasia, which resulted in a mild to moderate hearing loss in both of my ears.
Hearing loss actually affects a huge number of people worldwide. 25% of American adults experience some kind of hearing loss, and almost 50% of people are going to experience some kind of hearing loss. People with hearing impairments definitely have problems with quality of life.
Growing up, I wasn't allowed to participate in certain sports, and I never really spoke up for myself either when it came to not being able to hear things. After asking somebody to repeat themselves more than once, you tend to get embarrassed and you just don't want to ask at all. I started to have more problems once I reached high school, so my audiologist was like, I think it's time for hearing aids. It helped me tremendously. I could finally hear the leaves rustling outside and the birds chirping in the morning, which was such a huge deal for me.
It's been shown that hearing exposure can cause what's known as hidden hearing loss, which is basically when you are able to hear sounds in quiet without a problem. Once you get into a more complicated environment, you can have a lot of trouble if you have just a little bit of hearing loss. And the more hearing loss you have, the more difficult that can be.
There are times I personally might not want to go to like a really big dinner at a restaurant because I know I'm going to struggle to hear everyone talking. It's just really difficult to feel included and to feel like you're heard and to be able to contribute to a conversation in general. I have noticed women tend to speak up more and speak more clearly versus when I do talk to men. Normally, I do get more of a mumbled and deeper, quieter conversation, which can make it a lot more difficult. When it comes to engaging with others who have a hearing loss, the best thing that someone can do is to not cover their mouth. I've gotten really good at reading people, and I can tell when it's like a question versus a statement. It's extremely important to have a support system. My mom has always reassured me that I can do anything that I set my mind to. This hearing loss does not define you. You are so much more than that.
So now let's talk about key takeaway from the video. The first one is communication struggle. As Caitlin mentions that she was having struggle communicating with male rather than a female because of their high-pitched noise. Also, she was not comfortable going out in noisy environment like a restaurant because she was pretty sure that she will not able to hear the other person talking, like what they are trying to say. Which brings me to my second point, social isolation. In her case, she was not allowed to take part in certain activities in school when she was at the age of 6, which brings her social isolation in adulthood. Self-advocacy. Whenever she go out or any kind of like healthcare setting or a restaurant, she always need to advocate for herself. Like asking the person to repeat himself, which makes her embarrassed. The lip reading skill is crucial skill for her right now, as she acquired this skill and now she is able to distinguish between if the person is asking a question or putting a sentence. Also, the major trumpet for me in her case is hearing aid, which we can get to know about that after putting hearing aid in her college year, she was able to hear others surround like environmental noise, which she never heard of from past, like from the age of 6. So these are the key takeaway which we can take from the video.
Dental challenges for hearing loss. Client with hearing loss may face unique challenges in the dental setting, which can impact communication, oral hygiene, and overall dental care. So let's go through some key challenges they experience. Many clients rely on verbal communication to understand dental procedure and instruction. If a client has hearing loss, they may struggle to follow spoken direction, especially if they can't see the speaker's lip, or they may have difficulty hearing the verbal instruction or how to position themselves or how to manage discomfort during the procedure. Trouble with learning oral self-care, which could contribute to high plaque accumulation, higher risk of gingivitis and periodontitis. Dental equipment like ultrasonic scaler, high-speed handpiece, and suction device create background noise that can be disruptive for clients with hearing aids. Reliance on lip reading hindered by masks and shields. Many individuals with hearing loss rely on lip reading and understand speech. In a dental setting, mask and facial block visual cues, making communication more challenging for them. Higher prevalence of bruxism in individuals who are deaf, possibly as a sensory response. Some have higher occurrence of bruxism or teeth grinding. This could be response to sensory processing differences or stress also lead to tooth wear and potential TMJ issues. Oral manifestation. Hearing loss doesn't just affect communication, it can also have an impact on oral health. Certain habits, medical conditions, and assistive devices used by individuals with hearing loss contribute to specific oral hygiene challenges. Oral manifestation includes xerostomia due to mouth breathing. Poor oral hygiene increases risk of caries. Communication barrier may lead to difficulty understanding oral hygiene instruction. Lack of awareness or proper brushing technique can result in plaque buildup and caries. Discomfort wearing dental appliances such as mouthguard. Some clients with hearing loss may experience oral sensitivity, making it uncomfortable to wear dental appliances like mouthguard or retainers. This can be a challenge for those needing protection from bruxism or sports injuries. Oral mucosa soreness and caries on the supporting teeth occur if clients have intraoral hearing system and poor oral hygiene. Some individuals with severe hearing loss use intraoral hearing devices. As you can see in the picture, an intraoral hearing system can help by using the teeth and bone to conduct sound to the inner ear. It includes removable intraoral microphone and microphone worn behind the ear. If they don't maintain proper oral hygiene and self-care, food and bacteria can accumulate around the device and leading to soreness, irritation, or can be cavities nearby the teeth.
Here we are going to talk about the dental treatment plan and adaptation. Each patient has different unique situation, so it's important that they receive the highest standard of care. This might mean working together with the patient to find any areas of oral hygiene they are struggling with and able to make appropriate recommendations for them. In order to most effectively teach hearing impaired patients about their oral hygiene care, here are presented some of the most effective ways we can apply to provide the treatment. First is use effective normal communication methods such as facial expression, gesture like thumbs up, eye contact, enhance understanding and avoiding any negative facial expression. Second is minimizing background noise and distraction like turning off the music in the operatory and choose a quiet treatment area. Next is providing written and visual aids for treatment plans and post-op cares, allowing extra time for the appointment for effective communication, like using email, text, or mail instead of phone calls, and we can use written brochures and visual aids for better understanding of oral care instructions. Also, we can speak on the patient's strongest hearing side and maintain eye contact, and we can plan longer appointments for effective communication and allow extra time to make sure that we are giving enough time to educate oral hygiene and making sure that they are understanding the treatment plan and their needs are fulfilled, avoiding any rush during the appointment. The last is avoid masks that block lip reading, in which we can use clear mask or remove mask while speaking with the patient.
Oral self-care regimens. Regular brushing. Brushing twice a day with soft bristle toothbrush. Providing visual pamphlets that show the correct brushing steps and techniques can be helpful. Pictures demonstrating the impact of brushing regularly versus brushing less can highlight the importance of consistency in preventing oral disease. Regular flossing at least once a day. Floss threaders might be difficult for clients with hearing impairments as they may struggle with learning the correct technique. Floss picks or electric water flossers are great alternatives. Using electric toothbrushes may be more effective for some. Some models have lights to indicate brushing time, pressure sensors to prevent excessive force, and vibrating alerts to guide brushing. Many also automatically stop after 2 minutes to ensure proper cleaning. Smart toothbrush apps. Brands like Oral-B offer apps with animated guides to help clients brush all areas properly. Dietary modifications. Avoiding highly carcinogenic food and sticky foods is important, especially for those with intraoral hearing systems, as food particles can get trapped around the device. Maintaining good oral hygiene and regular dental visits is essential to keep the surrounding teeth healthy, as they play an important role in how the device functions. Mouthwash. Using mouthwash helps flush out trapped food particles and reach areas that brushing alone might miss, especially in posterior teeth where the device is placed. So by implementing these strategies, we can help clients with hearing loss maintain optimal oral hygiene while addressing both their dental and hearing needs.
So now let's talk about how we as a dental hygienist can advocate for hearing loss community. The first and foremost is by raising an awareness about the link between oral health and overall health in the hearing loss community is crucial due to knowledge gap, access barrier. Probably they don't know that how much the oral health is correlated with the overall health. To promote that, we can use social media as well as pamphlet. We can go to the nearest like long-term care where we can find a hearing loss community as well. Promote accessible dental care, like clinic must prioritize communication accessibility, assistive device, clear mask, visual aids, and all the other things which can help hearing loss client to better educate and better understand what dental hygienist is saying. We can support research. The more research on the oral health needs for the hearing loss community will drive target intervention and better care. So the other thing which we can do as a dental hygienist is collaborate with organization, like partnering with hearing loss organization like Canadian Hearing Society, Canadian Hard of Hearing Association, which can amplify our message and strengthen our impact on overall community. Also, we can educate dental professionals, like training dental professional in communicating strategy, also cultural sensitivity is key to provide accessible care. Before ending today's presentation, I just wanted to let you know that while researching for this topic, we get to know about a person named Amanda. She's a registered dental hygienist in United States, also have hearing impairment, but currently she is advocating for all the stuff we mentioned in this presentation. She is advocating this through her foundation named That Deaf RDH. She is providing like scholarship for hearing impairment person, also helping clients to get a proper care within the dental hygiene settings. And yeah, like kindly go through it so you will get to know about all the other stuff which she is doing as well. And this is the end of our presentation. Thank you very much for hearing.